Welcome to the deep dive. Today we're plunging into, well, a really interesting area, medication phobia, sometimes called pharmacophobia.
Exactly. And we're talking about a genuine, sometimes quite intense fear of using medications.
Hmm.
Often it comes with a sort of generally negative view of drugs overall.
Right.
Now, look, being careful about side effects or, cautious with drugs that could be abused, it's perfectly sensible. We all do that.
Sure, yeah.
But what we're focusing on today is when that caution tips over into a real phobia,
Yeah.
something excessive, irrational, really impacting decisions.
Precisely. Because while being a bit wary is one thing, this deep dive is really about the serious harm this phobia can cause. We're talking people refusing treatments they actually need.
Yeah, or big problems with just taking the medicine as prescribed, compliance issues.
And it even affects parents, right?
Yeah.
This deep worry about giving medications to their children.
Absolutely. And, it's important to remember, even these really strong fears, they often stem from somewhere. They have roots. So our mission today really is to unpack all that complexity around medication phobia using the sources we've looked at, explore the causes, the effects, and maybe some ways to approach it.
Okay, let's get into that. What's the real line between someone just being, understandably cautious about a new medicine and someone actually dealing with medication phobia?
That's a really key question. I think it basically boils down to the level of fear and how it changes behavior.
Okay.
Someone who's just cautious might, ask their doctor lots of questions, maybe look up side effects online,
Hmm.
want to understand the risks versus benefits, healthy stuff.
Right. Normal due diligence.
Exactly.
Yeah.
But someone with pharmacophobia, they might feel, well, overwhelming anxiety. They might actively avoid taking any medication, even if it's clearly necessary. There's
Mm.
often this really negative core belief about drugs in general. Like the sources say, being wary of abuse potential, being aware of side effects, that's fine, sensible. But when it becomes a phobia, it can stop people getting essential treatment. And uh, that can obviously have some pretty serious health consequences.
And it's not always just a flat-out refusal, is it? That avoidance can look different.
Oh, definitely. Our sources point to medication noncompliance as, another major outcome.
How so?
Well, someone with this phobia might, say, start taking a prescribed drug, but then stop almost immediately because they're just so afraid of potential side effects, even if they haven't actually felt anything bad yet.
Ah, right. The fear itself stops them.
Yes. Or maybe they take it, but really inconsistently. Skip doses, take half doses. And that can just completely undermine how well the medication works, sometimes making it useless.
Okay, so what are the things that can actually, push someone towards this? What triggers this kind of deep-seated fear?
Well, the sources highlight a few key factors. A really significant one is having unpleasant side effects from medications in the past.
Yeah, that seems logical.
And what's interesting is the sources add that sometimes these reactions might happen because, well, maybe the prescription wasn't quite right for them initially, or perhaps the starting dose was just a bit too high.
That makes sense. If your first experience is really awful, yeah, I can absolutely see how that would color your view of all medicines going forward.
Exactly right. And the problem can get sort of compounded if maybe the patient or even the doctor isn't fully aware that that person might be more prone to side effects.
Oh, like who?
The sources specifically mention people who tend to be anxious anyway, and also older adults. They might just be more sensitive.
Okay.
And here's a fascinating bit. If someone does have a side effect, but they don't really connect it to the medication, or maybe it's not clearly explained, that negative experience can still sort of attach itself to the idea of medication in general, strengthening the phobia without a clear link.
Wow, so the fear just kind of takes root, even if the cause isn't properly identified.
Precisely. It takes on a life of its own. Another trigger mentioned is going through difficult withdrawal symptoms, particularly from psychotropic drugs, meds affecting the mind.
Ah, yeah.
The Ashton Manual comes up here, and it really details how tough withdrawal can be. That kind of experience can absolutely create a lasting fear, a real reluctance to take similar meds again.
I can definitely see that. Withdrawal sounds really unpleasant. That makes sense. You'd be hesitant afterwards.
Yeah. And one last trigger the sources mention, which is, well, quite subtle sometimes, it's when people mistakenly blame the medication for symptoms that are actually caused by their illness.
Oh, right. So they feel unwell because they're sick.
Exactly. They feel unwell because of the, say, acute infection, but they think, oh, it must be this new antibiotic making me feel terrible. And that reinforces their fear of the drug.
So the very thing meant to help becomes the perceived enemy. That's tricky. Now, you mentioned earlier this can show up with parents and their kids. How does that typically play out?
Yes, that's a really important to mention. For parents, medication phobia often centers on this deep worry that the medicine will actually harm their child more than it helps.
Hmm.
The books we looked at, the ones on headaches in children and teens, they really highlight this parental anxiety. Parents might worry about, unknown long-term effects or how drugs interact or
Yeah.
just the whole idea of their child needing medicine regularly.
It's almost like a protective instinct getting dialed up way too high, maybe?
That's a great way to put it, yes.
Yeah.
They're trying to protect their child, which is natural,
Yeah.
but the fear can lead them to refuse treatments that are actually necessary or, again, not give the medication consistently. And ultimately, that can harm the child's health or well-being.
Okay, so given all these different routes and ways it appears, what can actually be done? Are there effective strategies to help people, manage or overcome this medication phobia?
The sources do suggest a couple of key approaches. One really practical point is the benefit of starting medications at very low doses and then increasing the amount really gradually, slowly. This titration, it helps the body adjust more gently. It can potentially avoid those strong initial side effects that might, kickstart a phobia in someone who's prone to it.
Right, yeah. A less intense introduction might feel safer, less likely to trigger a bad reaction. Makes sense.
Absolutely.
Yeah.
And the other strategy mentioned is, well, quite clever therapeutically. It involves using test doses.
Test doses.
Yeah. Either of the actual drug they're afraid of, or maybe another one from the same class of drugs. The idea is to carefully demonstrate to the patient that their previous bad symptoms were likely due to their illness, not the medication itself.
Ah, I see.
There's this case study mentioned about statin phobia and something called idiopathic anaphylaxis, basically, severe allergic type reactions without a clear trigger. Using controlled test doses helped show the patient the statin wasn't the cause, which helped break that fear connection.
So it's kind of like a very gentle, careful form of exposure therapy, in a way. Helping them see the fear might not match the reality of the drug for them now.
That's a really good analogy, yes. By giving them direct, positive, or neutral evidence that the medication isn't the problem, it can help rebuild some trust and, dial down that phobic response.
This has been really illuminating, actually. So just to kind of pull it together, medication phobia, it's clearly way more than just being a bit cautious.
I don't know.
Its impact on whether people actually take necessary medicine can have really serious health consequences. And we've seen it can stem from all sorts of things. Bad past experiences, maybe not fully understanding side effects, even tough withdrawal periods.
Right?
And importantly, it shows up in parents too with those deep concerns about their kids. But there are ways to address it, like starting low and slow with doses and maybe using those test doses to help separate illness symptoms from medication effects.
Exactly. It's definitely a multifaceted issue, isn't it, with quite significant real-world impacts on people's lives.
Yeah. Thinking about all this, it really leaves you with some big questions, doesn't it? What does this all mean for how doctors and patients actually talk about medications? Communication is key.
And maybe even more. How can we develop ways to treat people that are more tailored? Ways that really take into account potential anxieties and fears right from the start, maybe to help prevent this phobia developing, or at least lessen its impact. It's definitely some food for thought. Thanks for this deep dive.